Eso es. Sigue le dando otra vez.
Ya le hizo la transición,
y luego input y luego la flecha que apunta hacia acá, hacia...
Como un minuto de delay. Hay un minuto como de delay. Sí, porque acabas de pasar.
Bueno. Sí, es que así es.
Vamos a darle al balance de blancos.
¿Me regalas otra compresa?
Well, we also put a link to our 360 virtual reality live stream that we're doing at the same time. We've got a new development, state-of-the-art 360 VR camera right above us. And if you have goggles or if you've got your mobile device, you can download the YouTube app and watch there. And if you're on your PC, home computer, laptop, you can use Google Chrome. And it's a spectacular, immersive experience. So come on into the operating room with us and watch as we perform surgery. So for those that are seeing the 360, you guys are floating above the patient who was kind enough to help let us use this surgical procedure for demonstration. Now, for those of you watching 360 again, it's very interesting because, well, you get to see a bird's eye view of the whole surgical procedure, the operating room. I want to direct your attention to numerous things. First of all, first thing you're going to see is that the patient is lying down and the surgeon, which is me, is between the patient's legs so we can have a better access to the surgical field. Another interesting fact is that you can see, if you see down, if you're watching the 360 live feed, what you're going to see is that we have inserted some instruments that I'm using to perform surgery. These instruments are going through the abdominal wall. Now, inside the belly, inside the abdominal wall, well, there is no light. So we need to insert a telescope that's connected to a camera and that has a light source that gives us the ability to view the abdominal, intra-abdominal anatomy. Something also pretty interesting is the fact that the belly, well, it's collapsed. We need to inflate air in order to be able to lift up that abdominal wall and create a space so that we can work in. Now, the surgical procedure we are doing, you can see, again, if you're seeing the 360 feed, go ahead and watch my hands. On my right hand side, descending to us. All this imaging is done in high definition. Well, because the better definition we have of the images, the more precise we can be. So for those of you that have never seen this surgery, you can expect to see maybe 20-25 minutes of surgery. And I encourage those that are online, if you have some questions, you can go ahead and ask them, and I'll try to answer them. So what we're seeing right now, go ahead and view the screen. This is the highest part of the stomach. This is where the stomach joins the esophagus. Now, as you can see, I am between the patient's legs and my instruments are pointing towards the patient's head, which means that right here, if I were to continue dissecting upwards, I would find the heart. In fact, you can see the heart beating against the diaphragm. This rod you see here is a liver retractor. This is the liver. And you can see the heart beating behind this. Look at that. There's your heart right there.
You have a question?
Yeah.
Could you show the port site?
The port site. The port site. Well, actually, if you're seeing the 360 VR, you are going to be able to see basically everything, which is awesome. But if you're not seeing the 360 feed, which by the way is a historical feed, doing live 360 virtual reality surgery in a duo is something that's never been done. It's done very few times, and I think we're pretty sure that we were the first ones to do live streaming of 360 virtual reality. And for the Facebook viewers, you can see the ports there, down here, around. They're horizontally placed. Here comes the calibration tube. Let's go a little bit more. Beautiful. All right. So what anesthesia has done is introduced a thin tube, which is around the diameter of your thumb, let's say, 1.2 centimeters. And right here, we're going to measure 5 centimeters. Here's the tube inside the patient's stomach, been passed from the stomach. And go ahead and watch the screen and see this stapler, which I am activating, is going to cut and leave 2 staple lines. And then we've seen over the years that gastric surgery requires a certain finesse in order to be not only effective but durable. Durable meaning that over the years, 5-10 years from now, this patient should still have the effects of weight loss derived from having this procedure done. Unfortunately, some technical aspects actually can cause one of these surgeries to fail. So we're about to do the second to the last staple. We're going to staple one more time, and then we're going to completely transect the stomach. Now you can see on the right hand of the screen, we have stomach still attached right here. Then this last staple is going to go ahead and sever it off completely. Now we're going to go and perform some suturing. Now for those of you watching in the 360 feed, it's very important that you guys see the correlation between how my hands are moving and the stitching going on inside. These images are very magnified, 20 to 30 times. So if you're viewing in the 360 feed, you can actually get a great idea of the internal anatomy. For those of you watching in the 360 feed, as long as you've got a good wireless, you'll be able to view a nice 1080 image. Go ahead and change the settings on your YouTube to higher definition. As long as you have a good, solid bandwidth on your wireless. All right, so now what we're going to do is to happen soon. Okay. And you got behind the scenes, everybody knows Sophia. She's holding the camera. She helps us out a lot with the Facebook live procedures. So this patient is going to go on to recovery after we finish the surgical procedure. Usually they're there around 30 minutes. And then they are taken back to their room where they fully recover hours after the procedure, usually, typically. And patients are usually walking around a couple of hours after the surgery and are discharged back to the hotel less than 24 hours after the procedure is finished. Now what you're seeing right now, and I failed to explain completely, is that once we've stapled part of the stomach and created this narrow sleeve-like tubular stomach, we're going ahead and reinforcing that staple line. The staple line, even though this image looks red, in fact it's highly magnified, and you'd be surprised that it's just a couple of drops of oozing of blood. But as you can see, as I'm progressing distally, I'm hiding the staple line. I'm effectively actually reinforcing this staple line to make it a leak-proof, but also a fail-proof surgery. Again, the surgery, even though it could be considered laborious, takes us around 20 to 30 minutes to complete. Okay, so in fact, my OR tech is telling me that it's been 20 minutes since we started. Because we don't want to bore you. It's Friday. Thank God it's Friday. Shout out to all my friends. Air, pass air through it, so we can blow up this new stomach and check for bubbles. We're going to do something we call the flat tire test, and we're going to start doing that right now. So what we're going to do, remove this suture. We're going to go ahead and start removing backing it up. Here it goes, back it in again. We're going to leave it right there. Okay, just right there, perfect. That's the tube that's passing into the mouth all the way down into the stomach. And I'm going to ask him now to mobilize the patient and tilt the patient backwards so we can accumulate as much liquid as possible over here on this end and kind of flood the upper abdominal cavity with water. And then once that is done, we're going to ask him to blow up a little bit of air.
I have another question.
Yes?
Don't you think that maybe if you wait 20 seconds after closing the stapler could cause you to have less bleeding in the staple line?
Okay, so somebody's obviously a surgeon. Yes, if I wait 20 seconds after each staple, I'll have less bleeding, but you guys can see on the screen, ¿listo? ¿Inflamos? Okay, we're gonna inflate right now. Oh, and it's inflated right there, and no leaks. Perfect, no bubbles. But as you can see, this liquid I just injected is not even red, which means that the bleeding was negligent. So yes, this technique of stapling and leaving the stapler there for 20 seconds, I feel it's just too time consuming.
Plus we're gonna suture.
And since in fact we're gonna be suturing, that stops the bleeding if any bleeding does exist. So right here, we're gonna ask anesthesia to remove the tube. I think they did. Okay, okay, beautiful. All right, and we're gonna pull out the stomach. Háblenle a Manny.
Just like this.
0.5 centimeters in width. This is where the stomach ends, and it converts into a small intestine. We're gonna go over here to this side. You can see the gallbladder back here. I'm gonna aspirate a little bit of liquid, just so we don't leave anything. We don't use drains in this surgery. This procedure is, even though we explained it step by step, it's 25 minutes surgery, and we are finished.